My name is Roger Foisey, and I am a personal injury lawyer, a lawyer for the people of Ontario. Today, I would like to explain why mild traumatic brain injuries are so often overlooked. Mild traumatic brain injuries are missed first and foremost because people fail to think brain first. To explain this idea further, imagine you're in an automobile accident. If you have a neck strain injury from a whiplash and a broken arm, you are likely to attribute your pounding headache to those injuries. People dismiss symptoms of brain injury, believing that they are just side effects from their more obvious injuries. Likewise, physicians will prioritize the most recognizable physical injury. Many healthcare providers do not specialize in brain injury and therefore may not recognize the severity of the brain injury in cases where there is no visible head trauma. Another reason why mild traumatic brain injuries are missed is because a person's behavior immediately following the incident is not a reliable indicator of the true extent of the brain injury. Some difficulties only become apparent after some time has passed. These residual post-concussive effects can be subtle, but they can make life difficult, especially if the person does not realize their difficulties are due to a brain injury. My clients have told me, "I just don't feel like myself," or "I feel like something is wrong, but I don't know what." When a brain injury goes undiagnosed, people may feel off, but they have nothing to attribute their feeling to. This can lead to confusion and frustration. Even when a mild traumatic brain injury is suspected, it is very difficult to test for. Neurological imaging evidence can be elusive because the brain is so complex, and often the damage is not obvious. The Glasgow Coma Scale, GCS, is an assessment of the severity of a brain injury used by healthcare providers such as paramedics, nurses, and doctors. However, a normal GCS does not mean you have not suffered a brain injury. Unfortunately, many people, including healthcare providers, equate a normal GCS with a person having not suffered a brain injury. As you can see, the GCS is limited when diagnosing mild traumatic brain injury because the injured person may seem fine immediately after the accident. But as my clients have experienced, they may later go on to exhibit symptoms. Take, for example, a client of mine who suffered predominantly physical injuries from a car accident. These obvious injuries were the focus of attention at the hospital. Weeks later, however, she continued to improve from her physical symptoms, namely her neck and chest injuries. However, she then began to notice that her other symptoms, which were never prioritized, were not improving. These symptoms were headaches, dizziness, ear ringing, and problems with concentration, focus, and memory. These difficulties were now preventing her from getting back to her normal activities of living. 10 months later, this client has been unable to return to work or participate in her normal daily activities. She has no less than 5 medical practitioners as part of her team in her attempts to regain her life following what was thought to be only a minor neck injury. Unfortunately, many people with mild traumatic brain injuries are told they just have a concussion and they're sent home with painkillers. They do not receive the diagnosis or the treatment that they need, and sometimes their symptoms do get worse. That is why it is important to think brain first and recognize when you might be suffering from a brain injury. If you know where your difficulties are coming from, you will be able to seek out the help that you require. In order to receive appropriate compensation and care, if you have been in an accident where another person is at fault, it is important to have a lawyer who can recognize mild traumatic brain injury and who has worked with clients with brain injuries before. In my next video, I will be discussing how your lawyer can help you access funding for medical rehabilitation after suffering a mild traumatic brain injury in a motor vehicle accident. So thank you for tuning in. I invite you to check back with us often for the latest videos, blogs, and resources on my website at www.injurylawyercanada.com.